For Syria, as a significant refugee hosting country in the past, it is unconscionable that for 10 years, humanitarian aid has been consistently delayed, denied, and instrumentalized, despite the clear and consistent needs of so many Syrians and as Palestinians and other refugees. There are basic human rights and humanitarian needs, food, water, healthcare, and education that must be met regardless of which group controls which given territory. With the medical sector vastly diminished by deliberate targeting, incidental damage, and the flight of medical workers, the COVID-19 pandemic risks overwhelming remaining medical staff and other frontline workers in Syria. Principled and rights-based humanitarian access must be restored without delay. Moreover, for 10 years now, we have seen that the same patterns of violence and human rights abuses that prompted protests and later sparked conflict are now practiced by almost all armed actors in Syria. As territorial control has shifted and children, women, men, and the elderly have been killed, maimed, repeatedly displaced, deprived of livelihoods, and left to suffer in the physical and economic ruins of their country. This continuing race to the bottom regarding respect for the human rights of Syrians must stop. It is imperative for the parties to the conflict to remember that each person, regardless of where he or she lives, or who controls which territory, or their religious, ethnic, or political identities, or those of their families or communities, they all possess intrinsic, fundamental human rights.